Welcome back to our live coverage at Children's Hospital as we take a look at the colorful lobby from high above. Remember, a moment ago we took you inside the NICU. While I was there, we arranged a reunion of sorts. We didn't know it beforehand, but room 452, the NICU room where tiny Berkeley is the same room my son Braxton called home for 70 days, back when he was born premature in 2004. Here he is at 2 pounds, 13 ounces. My son had a lot of questions for this family.
I love that she's learned to hold her binky already.
I know. She just learned that last week. She started doing it.
Perhaps the conversation helped encourage them that their daughter will one day be able to come here and visit too. Berkeley, who still has health challenges ahead, is approaching 5 pounds now. That's close to the size Braxton was when he finally went home. 11 years later, it's working all right for Braxton. He's here manning the phones along with his mom, Beth. We never really thought we'd be here, right?
Oh gosh, we never thought we would be here, much less 70 days. That's why this is so great, because you're really helping those who are unexpected.
Well said. Well, we're here until 7 along with the Cat Radiothon folks, talking about what benefits with your donations, such as those who break their bones very easily. How is it that a child with brittle bones can do this just feet from their parents and they don't freak out? Do you know how many bones you've broken?
I think about 50.
50?
That's pretty close, yeah. You kind of quit counting after a while.
Is that where it's tender, honey?
Because of the care and expertise, Sophia Nori and her family traveled 7 hours from Minnesota for a checkup at the Osteogenesis Imperfecta Clinic at Children's. After all, this is a girl who broke her leg in the womb. Jacob Becerra and his family drove 10 hours from Texas to be here. He recently broke his arm throwing a foam ball.
He was never meant to walk. Before we came here, he was actually not moving. He was just pretty much laying on the bed and looking at the ceiling.
I love your x-ray machine.
The clinic is a one-stop teamwork shop to save patients time since they come from all over the U.S.
You can see it was there last year.
The same morning allows orthopedic surgeons to review x-rays.
Good job.
A dentist checks in.
Sophia, can you skip for me?
So does a physical therapist and a host of others examining their diets and life at home.
A greater percentage of patients are walking as opposed to being in wheelchairs. Or if they are in wheelchairs, they're in wheelchairs for a smaller period of time. So that's what we've really experienced over the last 20 years is an improvement in mobility, in quality of life.
Where's your hand? That's your hand.
Jacob wrote a thank you to his surgeon on how he loved the x-rays and drew his own versions.
And that's the window.
Sophia is an artist herself, showing off the plans for her treehouse one day.
She has big ideas. She'll even dig holes in her yard making something. Came back from a camping trip and she wanted to build a porta pot, so she started digging the hole for the porta pot in our yard.
Years ago, parents would carry their OI child on a pillow, fearing anything else would lead to broken bones. Advances in medicine and surgery techniques with a team approach offer so much more now.
The biggest things that we've seen is the kids are much more active now than they used to be. Instead of sitting in a wheelchair and being on chronic narcotic pain medicines, they're up running around causing trouble for themselves. So they've created new challenges for us.
So Jacob can be an astronaut.
Where are you gonna go?
To the moon.
To the moon?
And Sophia, anything's possible.
We expect her to do great things.
I know I shouldn't, but I still get anxious when I see them running down that hall. The Brittle Bones Clinic sees 200 kids a year. When we come back to our live coverage here at Children's, the story of a child who's been here for nearly 2 years.